After engaging in sexual activity, it's important to take certain precautions to protect against sexually transmitted infections, STIs, and unwanted pregnancy. Here are 12 steps you can take immediately after sex. Use protection. If you didn't use a condom during sex, consider using emergency contraception, morning after pill, to reduce the risk of pregnancy. Emergency contraception is most effective when taken as soon as possible after unprotected sex. Urinate. Urinating after sex can help flush out bacteria from the urinary tract and reduce the risk of urinary tract infections, UTIs. Clean up. Wash your genital area with mild soap and water to remove any bacteria or bodily fluids that may increase the risk of infection. Check for condom integrity. If a condom was used, check it for any signs of damage or breakage. If the condom broke or slipped off during sex, consider emergency contraception and get tested for STIs. Consider emergency contraception. If you're not planning to become pregnant and had unprotected sex, consider taking emergency contraception as soon as possible to reduce the risk of pregnancy. Emergency contraception is available over the counter at most pharmacies. Discuss STI testing. Have an open and honest conversation with your partner about STI testing and consider getting tested together. Many STIs don't cause symptoms, so testing is the only way to know for sure if you've been infected. Take a shower. Taking a shower can help wash away bacteria and reduce the risk of infection. Avoid using scented soaps or douches, as they can disrupt the natural balance of bacteria in the vagina and increase the risk of infection. Change bedding. If you had sex in bed, consider changing the sheets to reduce the risk of transferring bacteria or bodily fluids to other surfaces. Stay hydrated. Drink plenty of water to stay hydrated and flush out toxins from your body. Proper hydration can also help reduce the risk of urinary tract infections. Avoid vaginal douching. Avoid using vaginal douches or other products to clean the vagina after sex. Douching can disrupt the natural pH balance of the vagina and increase the risk of infection. Consider prophylactic antibiotics. If you're at high risk for certain STIs, such as gonorrhea or chlamydia, your healthcare provider may recommend taking prophylactic antibiotics after sex to reduce the risk of infection. Communicate with your partner. Open communication with your partner about sexual health, contraception, and STI prevention is essential for maintaining a healthy and safe sexual relationship. Discuss any concerns or questions you may have openly and honestly. Remember that these steps are not foolproof, and the most effective way to prevent STIs and unwanted pregnancy is to use condoms consistently and correctly during sexual activity, and to communicate openly with your partner about sexual health. If you have any concerns about STIs, pregnancy, or sexual health, don't hesitate to consult with a healthcare provider for personalized advice and guidance.